Yes, come in. We are live with Equity. Come through. Come in. Yes, we are with you. Can someone just comment on the sound? Can you just comment on the sound? Can you hear us properly? Just one person. Okay, sure. Thank you, Ngabani. Thank you for your comment. I can see the feed. Thank you so much. Enkosi kakhulu, Dr. Tebelele. I see the numbers are growing. Welcome to the channel. Sino Sister Thuletu Siyange esizawuthetha naye namhlanje ngenjongo zothetha nge-TB. The sound is perfect. Enkosi Busi, thank you for the feed. Thank you for the feedback. We appreciate you. Now we know that you can all hear us. The sound is perfect and the picture is fine. And we hope we are also perfectly fine. And Sister Thuletu Siyange ozawuthetha nathi uphaya kwaKhwithi kwingalo yakwaKhwithi ekuthiwa Khusela TB. Yiproject ke leyo edilishana nokuphilisa i-TB apha kwiphondo leMpuma Koloni. Thuletu, can you kindly greet all our viewers? And we've got some of our team members in the background. Thank you for joining us.
Thank you, Dr. Tebelele. Let me first start by greeting you and the followers at large.
Thank you. What is your role ku-Equity na ku-Khusela? Can you just tell us about yourself a little bit, just to ease the nerves and to make sure that zonke inkonkitsi zikwamkele?
Thank you, Dr. Tebelele. I'm Sister Thuletu Siyange. I'm a TB focal nurse working for Equity in a Khusela project.
Yeah, Equity and Khusela project. Thank you so much. Role yakho ithini pha wenza ntoni? What is your daily activity? Ndiyabona umhla una-TB, awukhohlela uthimli. Xa uthi uphangela eTB, people will be scared.
Role yam, Dr. Tebelele, as a TB focal nurse, is to make sure that all the people who have been diagnosed with TB are being initiated on treatment. And all those who are eligible for TB preventative therapy, your HIV positive people, your under 5 children under 5 years, are being initiated on treatment. Remember, the aim is to end TB. And of course, the flow of clients and everything. I also support doctors, the lives of Dr. Tebelele, Dr. Jahana, and Dr. Mkilana, because they are also part of the project.
Thank you so much. TB is a very scary disease. Abantwana abaninzi okanye iyathanda uyanyaniswa nabantu abaphuwa okanye abandawo ezixineneyo. Can you just give us a picture? Ungakanani umthalo we-TB apha kule region yaseNelson Mandela Bay?
Nelson Mandela Bay is a high TB burden district. We've started the project mid-July, but in terms of the active TB cases that we have found, we're around 73 cases. I'm only talking about those cases we are finding in the community. I've not yet included the statistics of the clinics and the doctors and everyone. So it really shows that this is a high TB burden district.
Highest and one of the high TB burdened districts. That's very, very important. And then, Sister Thuletu, in the role ka Khusela, and how big is the Khusela team that is actually working in the region? Kauti, Nelson Mandela region is one of the recognized region in terms of its TB burden. How big is the team in order to confront the burden of TB in the region? Ukhusela iteam engakanani?
Okay, let me just take you on the background of the Khusela. We do have our project coordinator, which is Dr. Razia. And then you do have your TB focal nurse, which is myself. We've got the care ministry care workers. So they are basically the ones who are doing the door-to-door TB screening using a questionnaire, the likes of a cough, your drenching night sweats, all those questions on door-to-door. And what they are doing, they refer those clients to a digital mobile X-ray. So we're also using a digital X-ray as a screening method. So it's one of the scarce resources, the digital X-ray. So it's unlikely you find facilities as a digital X-ray. So Khusela is also supporting the district with a digital X-ray as a screening method. So if the politicians, when they are saying we want to leave no stone unturned, so that's basically what we are doing. So because we need electricity, so we park somewhere. Like currently, the digital X-ray is parked at Fear Plus Councillor's office. It is just opposite Fear Plus Clinic. So the care workers works around that area and door to door, touching all the households and everybody in the households, doing the TB screening in children and in adults, and then they refer to the digital X-ray. And then those who are symptomatic are being investigated. That is, we take GXP. And then those who are presumptive on TB, on the digital X-ray, we also follow with Gene Expert. And then all those who come who test positive, it's then that where the nurse chips in and then in initiating the treatment.
So a number of people actually have been demanding the X-ray, and so on. So at Khusela, you have made X-ray is a screening tool.
Ewe gqirha i-X-ray yenziwa nakubani na une-symptoms ungenazongo. Ukhumbule abanye abantu ababinazo ii-symptoms xa ubabuza laa nto bendisithi laa questionnaire sesiyibuze. Siyakubuza Dr. Tebelele, uyakhohlela ubili ebusuku ude ukhulula impahla, awehlanga esiqwini ude ubona uba ibhlukhwe lena iyazehlela. Athi uDr. Tebelele hayi, mhlawumbi ubona lena esaqombe yayena sihlaza kule nesi, athi hayi, sithi hayi ke yakwi-digital X-ray. Xa ufika kwi-digital X-ray, ikubambe i-X-ray, sitsho sikulandelele. Xa sifika nyhani uDr. Tebelele une-TB. Yiyo ke ngoku le nto siyisebenzisa as a screening method, i-digital X-ray. And iyadura xa uyoyenza privately inoba ungayenza nange-1,200 kodwa uKhusela is bring it free of charge.
X-ray free of charge, in order to make sure whatever piece of TB you have, it can be picked up by all methods. Feel free to throw your questions on the comment line. Any questions you have around TB. Any question around TB, noting that TB can affect any organ. Sister Thuletu, can you just take all of us through the common symptoms of TB in adults and in children? Is there any difference in terms of the symptoms that one can expect? When should I suspect TB?
Yes, Doc. The symptoms are a bit different in adults and in children. I think I've touched some in adults. It can be cough, persistent cough, or cough of any duration if you are HIV positive, drenching night sweats, unexplained weight loss, ndiyehla esiqwini kodwa andityi into eyehlisayo, or fever. So those are the common symptoms in adults. And then in children, you find out that this baby is not playful and then is not growing. You know, at the age of 6 months, maybe you're expecting the baby to be crawling, or you're expecting the baby to be recognizing the mother, and then you find out your baby is a bit delayed. And then when you also check we road to health card, there's a chart phayana uthi xa umsila umntana ekliniki iyabekwa iweight yakhe. So it's supposed to grow and follow a certain angle. So if your child is not growing, and then you suspect TB.
Uba uluzi weight and awutyi into yoluzi weight, awukwazi ucacisa uba kutheni nduluzi weight. Abantu bayathanda ucacisa, hayi, I'm on a diet, ndiyajima, ndiyathini. But if it's unintentional weight loss, usister uthi sondela kula track yakwaKhusela, which is currently in the Fear Plus area, and be screened for TB. TB yonke iyakhohlelisa, or should I consider myself to be at risk of TB even if I'm not coughing?
Singakhona ke lokhu doc nezinye impawu ube singakhange sijonge ukukhohlela qha. So kubalekile into yoba awuscreenwa because unempawu. You are screening because you want to make it a point that you are negative. The problem is it's only those who are symptomatic who wants to be screened. Ndike ndiyihleke ke gqirha kufike omnye ozise umntu athi hayi ndizisa yena nguye okhohlela nje nanto mna. So it means people must not wait for them to be sick or to be symptomatic in order for them to be screened for TB. Everyone should be screened for TB.
Everyone, including ourselves as health professionals. When do you actually screen for TB? Because since you're working with TB, it means to get wet. Same as TB.
Yes, when we have just started the project, our staff have been screened for TB, and we also have got a plan on 6 monthly routine testing for TB using a questionnaire and the screening method.
Is there any way that I can identify the Khusela team in the region? Can you just name all the team members that we can look out for? Have they got tags or do they wear overalls and whatever? Noting that
there's Khusela, there's name tag. And then if you don't find somebody who's wearing a t-shirt Khusela and a name tag Khusela, you'll find care ministry. Remember I said we also have got healthcare workers who are coming from another NGO, which is also supporting the community care ministry. And then you'll find them, they're wearing the scrubs, they're normally maroon or pink, and then they are written care ministry. And then of course their names.
Wonderful. You mentioned that Khusela does x-rays on everybody. There's a truck that is just offering x-rays, digital x-rays, and is helping a lot in terms of picking TB. That is not even very, very obvious. It's been very difficult to diagnose TB in people who are living with HIV. In terms of reducing the TB burden, the addition of x-ray, has it made any difference in terms of picking up more cases?
Yes, Doc, it has made a very huge difference. I remember some people, I think maybe we get used in the screening method, like using a questionnaire. Some people just say no, 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 no. So now that there's a digital x-ray, so we have found some people who have said no under normal circumstances. If a client is not symptomatic and then clinical is okay, there's no need for you to take a gene expert. But now that we are using a digital x-ray, if the x-ray is saying presumptive, and then you ought to take a gene expert. So we've had cases whereby a client was not symptomatic, but the x-ray was presumptive, and then gene expert came back positive. So it means if we didn't have Khusela and we were not using this digital x-ray, we were going to miss some clients, or we're going to diagnose these clients at a very late stage.
Wonderful. And then how is the community taking this additional tool of using x-ray? But what feedback are you getting?
They also want to do AME lens. Because one x-ray is very scarce, Doc. Some just want to use the x-ray just for experiment, but I've never been inside the x-ray and whatnot. So that's also nice, because at the end of the day, we are achieving what we want to achieve, because we want everybody in the Nelson Mandela to be screened for TB. So the response, and
how are the people, Dr. Siponyat is asking, how is the reaction of people in terms of being tested for TB? How are they reacting? Are they open to being tested? Is it positive communication, or people are running away? What is your experience as a team on the ground?
It's different, Doc. Okay, some people are very keen to be tested for TB. Some do not want to be tested for TB because of stigma. So we can never run away with the fact that there's still stigma attached to TB. So as healthcare professionals, we still have got a very huge role in destigmatizing TB by empowering our community. Because we find out that when we do health talks on daily basis on the container, we find out that sometimes it's just lack of knowledge. So it is our responsibility to share this knowledge with the community.
Wonderful. What challenges have you experienced in terms of dealing with people in terms of stigma? Because anyone who's got TB, there's a tendency for them to be isolated, to be ill-treated, to be treated as infectious, and people running away. What is your experience as the Khusela team in terms of stigma and discrimination of people living with TB?
Discrimination of people living with TB, it's still something that is out there. And you find out that it makes it difficult. Like clients, they take time to access health services because they don't want to be stigmatized by the families. And then some will default treatment because now Kufiku Magas and Magas does not know that I'm taking TB treatment. So this one will default. So I think the more we support our families and our clients who have been diagnosed with TB, we are also doing us a favor, because if that person is taking his or her own treatment correctly and on daily basis, so it's unlikely for that person to infect you. So sometimes abantu doc before ba disclose baqala bakuva uba wena ufinisha njani ngo-5 centimeter wempempe. If doc is open and okay about 5 centimeter, nam ndizawutsho bhodle uba hayi ndino-5 centimeter because ndive kuwe i-reaction yakho without like disclosing prior.
Wonderful. Ungakhalazi ke xa ndisiya ku-5 centimeter because once uye kwelo cala ndiye ndingaphumi. By the way, i-TB affects many organs. Many organs. What kind of tests are you doing to pick TB in other organs? You said you've got X-ray and then you've got sputum. Zikhona ezinye indlela that Khusela is using to pick TB in other areas, including impempe, amatyhalarha, isikhumba, bones, pleural effusions, and so there are so many kinds of TB. Are there any other methods? What else are you doing as a team to make sure, noting that the region is burdened, inomthwalo ongaphaya Nelson Mandela region in terms of i-TB, yiyo le nto nidena zohlala apha nayihlalela phantsi ninguKhusela no-Aphile.
And thanks to Janssen Pharmaceutical, our funder. Okay, Doc, because this is a community service and we are offering this digital X-ray outside, we don't have enough resources. But because we are supporting the Department of Health, Khusela is not a stand-alone project. We are supporting the Department of Health. So we do have the clinics, and then we do have doctors in these clinics where we refer our clients to. And then we also have got our doctors who are part of this project, which whom I've mentioned earlier, your Dr. Tebelele, Dr. Tahana, and Dr. Mgilana. So we do refer the clients to them.
Thank you so much, Sister Thuletu. There's a question on the screen from Zanele Mviti. Is asking, what is the duration of taking TB medication should one be found to be positive? Once umuntu afunyanwe uba unantsholongwane ye-TB, uyithatha ixesha elingakanani i-medication ye-TB?
Medication TB also depends, Doc, on what type of TB that you have been infected with. If it's like pulmonary TB, it's likely to be 6 months. And also remember, it's affected by a lot of factors. If you have interrupted your treatment, the more you interrupt your treatment, the more you are adding more days in that 6 months.
So if you miss doses, you are likely to get those doses added. Kukho the first 2 months ye-TB treatment, and then kubekho the last 4 months, what is called primary and continuation phase. Kawucacisela abantu ngaloo nto bayithetha ukuthini? What does that mean in terms of taking TB treatment, noting that a lot of people run away from TB treatment as zininzi ezipilisi and whatever, just to minimize default?
Okay. There's an initial phase that is where you are taking your treatment for 2 months, if you're talking of your pulmonary TB, and then there's a continuation phase where you are taking your treatment for 4 months. And there are also sputum in between. You know, abanye abantu bathi awunesa kaniboni andizuyitya le pilisi. But those sputum that are taken in between the treatment are the ones that are going to determine whether are you taking your treatment or not. And what we've noticed, Doc, is that in the first 2 months, because some are symptomatic and a bit weak, so they start like feeling better when they are going on continuation phase. So that's where you are likely to lose them, because a person now is saying that, oh, I am gaining a weight and then I've stopped coughing and whatnot. So it means let me just like default the treatment or interrupt the treatment.
And nethemba lento banivile TB treatment zininzi iipilisi kwezi nyanga zimbini zokuqala and then emva koko ziyehla nokwinamba yepilisi, but iipilisi zakho zithathwa ngokomlinganiselo weweight yakho. So it's not like we're going to be on that treatment obuqale ngayo umphelo, ziyehla iipilisi emva kweenyanga ezimbini. Then aphinde usister agxininise into yoba kuyaxhomekeka nentlobo le ye-TB unayo, zintlobo ye-TB. Xa i-TB isesiswini, xa i-TB lapha emadlaleni, le nto sithi yi-TB ye-lymph nodes, ibande noko ixesha ozawuthatha itreatment ngayo. Xa TB abdomen, TB meningitis, njalo njalo. But eyona TB ixhaphakileyo neyosulela kakhulu yile ilapha emiphungeni, ibanga uba xa ukhupha isikhohlela then wosulele umntu kakhulu. Can you talk about the spread of TB?
Okay, thanks, Doc.
And how do we minimize that?
Okay, because TB is airborne, so it can be spread when one is coughing, sneezing, singing. Worship team, where are you? When you talk of singing, I think of worship team. Okay, so one of the best methods that we recommend, cough etiquette. Ezazinto sizifundiswayo emakhaya xa ukhohlela and then you use your elbow, it's no longer a hand, or you cover your whole mouth with something that you are wearing, or you can have a tissue that will cover your mouth and the nose, of course, and then ventilation. Noba uhlala ebobosini, ibobosi malibe nazo ifestile. Uthi athi ke omnye umama wakwaHasti, ngelinye ixesha if you are staying in those small shacks, at least during the day khaniphume ke nibethwe ngumoya pha phandle, ningahlale nivalelene apha because you are increasing the risk of infection.
And then there's a question on the screen that I'm gonna read to you. Okokuqala, abantu abangamadoda, noting that in November we're focusing more and we're upping the gear in terms of men's health issues. How easy is it to get men? Men find it difficult to go to clinics. In terms of screening, now you've taken the service to where people are, Fear Plus and surrounding areas. What is the uptake of men in terms of TB screening? Anjani amadoda attitude yawo ayeza kwezi screening?
Hayi Dr. Tebelela, amadoda ayaxothoza, awalifuni uncedo. Ayaxothoza ukuza. But the funny part is that we've got most clients who are males and who are diagnosed with TB.
So kusenokwenzeka uba kule nto ucotha kwabo, they are actually harboring a lot of TB, and in that process they are infecting a lot of people. So bantu abangootata asijonganga impilo yempempe kuphela, nalo mpempe isenokwenzeka uba ine-TB. So i-TB is not only about you, it's an infectious disease. Sisifo esosulelayo, sisifo esinaba msinyane, uthimla nje kwakho utaka ii-droplets ezijinga emoyeni ixesha elide, then senorhogelwa ngabantwana, and i-TB ayiveli lula ebantwaneni, iyasokolisa. And Usipho Nyathi is asking, are men coming? you just answered that.
Yes,
men are coming, but they are sluggish. Now we're encouraging a lot of men to utilize the service. Instead of you going to the clinic has been brought to you, so that sireduce umthwalo sinokhusela wabantu abane-TB. Then the next question is from
before we take the next question, Doc, yeah? Kangoba side saxhoma nee-posters zethu kwezi ndawo zolonwabo. Uba uya kwaGqalani uzawufika ikhona iposter ka-Akwiti, you will find a poster for Akwiti, Lifa and Mafa. KwaBoxer near Ubuntu Pathways, you'll find our poster. A councillor's office, a Fear Plus, a councillor's office, which is also a rank office, eZwide. So sizama kangangoko ukuthi noba ngaba wonwabile phaya nakha kuyazi into yoba emveni kolonwaba mandikhangele i-X-ray ke ndiyotesta for i-TB.
Usipho, okay, sure. Uzukiswa Charlotte Mdleleni uyabuza uba nifumaneke eNelson Mandela Bay only nani ngikhusela okanye nisezawuhamba zonke ezinye iindawo?
Siyanqwenela ukuhamba zonke ezinye indawo. For now, we have started in Nelson Mandela in sub-district A. We started at Zwide Clinic, and then we have moved to Fear Plus. We are doing Fear Plus Clinic, and we're hoping to be there for the next 3 to 4 weeks. And then we'll be moving in sub-district A. And then we are hoping to touch B and C. We hope that Janssen Pharmaceutical will give us more funding and so that we can have this Khusela project in every region in the Eastern Cape. Because people, people are very comfortable to be nest in their comfort zone. You are being screened at home, and then the sputum is even taken there because even our chemistry team, they carry the cooler boxes, they carry your lab forms, and then they do everything at home, and then they refer you to digital X-ray, and then from the digital X-ray, if you are positive, you are being taken by a nurse and then transported to the clinic. You are being initiated there without waiting the whole day in the clinic, and then your whole family is also being screened and initiated on TB prevention, those who are eligible.
What excuse can you really have? Everything is done for you. Awuzuthi andinabhasi fare uyoya ekliniki, andinantoni. Everything is done to meet you halfway. What else? Ungathi ukhalelani. Then usiphelo ntaphane ucela ubuza apho nisebenza khona, or uthi apho wasebenza khona kukho indoda ekhohlela ide igobe and esifubeni sakhe womile and ku-empty. Sometimes sike sisebenze nawo le ndoda emotweni enye. Ingaba ezo ayizizo na iimpawu ze-TB?
Besitshilo kaloku ukukhohlela yena mpawu besiyibalile ekuqaleni. Yes.
Definitely. Once you cough and you cough persistently, even if the cough is not productive, you just need to go for screening. And the screening now is at your doorstep through Khusela project. Then
oh, sorry.
This man that is coughing.
Omuzothi nasi isikhohlela doc, so uyakwazi ke nokusela amanzi ashushu, emveni kwamanzi ashushu ziyaphuma, uyakwazi ke nongathi uyajima, siyakwazi nokuncedisa kwaphayana ukuthi ngendlela ezinokwenza asiphume isikhohlela. Omnye uzothi hayi ndiyakhohlela kodwa ke andinazo, aside singaphumi.
So isikhohlela esingaphumiyo is not an excuse. There are ways of making sure physiotherapy and the nurses have got tricks around making sure into yoba isikhohlela or you do produce it. So if you cough, so le ndoda ikhohlelayo lo sisa irezayo ndicela sithethe nayo kakuhle, noting into yoba once ukhohlele ngoku, in a way COVID has actually helped us because people are scared of people that are coughing. So we should be, the same attitude should be applied to TB, but not by other people, by ourselves. When you are coughing, make sure that you go for screening your TB to make sure that you protect the people around you. And then after Fear Plus, which area will you go to? I think you have already answered that. That is a question from Veve. And then with Dr. Refilwe Maji, stigma is always an issue when talking about TB. How comfortable are the communities coming forward to be screened for TB?
At first, Dr. Tebelele, when the project has started, you found out there was a bit of resistance because of stigma. So now that this approach that we are using, everybody, regardless of the symptoms, is being screened and is being referred to the digital X-ray. So everyone now is a bit comfortable. So I personally feel like if we were just doing the digital X-ray to all those who are symptomatic, so people will be like skeptical to go to a digital X-ray. And another thing that has helped us are health talks. Remember, we've said earlier on that some people are stigmatizing others simply because of lack of knowledge. So we also do health talks in our digital X-ray. We also go sometimes inside the clinics and do these health talks to empower our community. We also have got pamphlets as Khusela project and posters, which I've just mentioned, where we've put them in the Nelson Mandela Bay. Even in the clinics, there are also posters about TB. So stigma is there and is likely associated with the lack of knowledge.
And the fortunate thing is that people like Obabu Nelson Mandela, he had TB, he spoke about it. People think TB is associated with a certain class of people. TB can affect anyone. Just like I said, it's an occupational hazard. We're working with sick patients. We can also get TB. A lot of health professionals, doctors, nurses, physios, some of them have had TB. They've had TB, so TB can affect anyone. It's not a disease of certain people, so let us not laugh. The time you hlekisa abantu abane-TB, the time you hleba abantu abane-TB, has come to an end, because it can actually affect any of us. Irresponsibility abantu in the household. What do you do about the household once you find that someone has got TB? Do you go beyond that person as Khusela?
Once someone has been diagnosed with TB, remember on our screening, we also have got a consent form where we are explaining the procedure to the clients. That, okay, Dr. Tebelele, when we screen, we are a Khusela project, and we are working with the Department of Health, and then and we just explain all the service that we are offering. And then we also assume that your results will be positive. Like your pre-test counseling, when you are testing somebody with HIV, you always assume that that person is going to be positive. You give that education prior the results. And then you ask the client, if you can be positive, will you feel comfortable if we come and fetch you so that you can be initiated on treatment? Will you feel comfortable informing your family that you are positive? Remember, there are also under 5s here. We need to put these under 5 on TB preventative therapy because they are mostly at risk. If there's a person who's HIV positive in the household, we'll also put that person in TB prevention. But what is also important, Doc, we maintain privacy and confidentiality at all costs. And we also make sure that we protect the surroundings and the families, because the aim is to end TB. So if we don't put the HIV positive clients on TB prevention, those who are contacts, and then if we don't initiate TB prevention therapy on under 5s, we'll never end TB. We are also encouraging all those people who are living with HIV, who have never had TB prevention therapy in their lifetime, to go and screen for TB and then to go to their facilities to be initiated on TB. Xa uphila nentsholongwane kubalekile into yoba isikhuseli se-TB uke usifumane once in your lifetime. Uyawumane ke uyifumana le TB prevention xa uthe wayicontact okanye kwakhona umntu one-TB okungqongileyo.
Thank you so much. That's well said. Can you explain for an ordinary person, how long will one take this TB preventive therapy? Is it only, you said it's children and people who are living with HIV mostly. For how long is the treatment given?
Kuyaxhomekeka ke doc uba ufumene ephi. Ngelakhi ke ngoku isebe lezempilo has got a very short regimen, which is the 3HP, that will take once a week for 12 weeks. That is 3 months.
Sister Thuletu, they like complaining that some of this treatment is causing them to have numbness, is there anything that you do to counter some of the side effects of TB preventive therapy and also TB treatment?
So what we are doing, Doc, and what we've also picked up as Khusela is that people who have been initiated on treatment, some will have those side effects, but we do give that health education to clients that in case you have these side effects, please reach out to us so that we can assist you. Like some, you can reassure the client, like if they are saying, my urine is orange, that's just need reassurance that no, it's just the tablets, otherwise it won't cause any harm. But there are those where you need to give maybe medication or yes. So what is important as healthcare professionals, you don't just initiate a client and go. Initiate and follow up. How is the treatment treating you? And also the responsibility of the client. If you are feeling side effects, don't just stop your treatment. Go to the healthcare professionals and say, this treatment is causing this and that, so that you can get help.
Nivile mawethu. Nivile awuvela uziyekele i-treatment inako ukwenza ube inako ukwenza isidama isisu sibe upset kancinci. Uyayinikwa i-treatment yopreventing cancer apha ezinyaweni, but awuvele uzithathele isigqibo. Unako ubona amehlo esiba yellow, le nto kuthiwa i-jaundice. Then once kwenzeka izinto ezinjalo, mhlawumbi le treatment uyidibanise nee-ARVs, kubalulekile into yoba uye kweli ziko lempilo buthatha kuyo i-treatment. That Khusela outlet ubukuyo okanye iklinik ubukuyo, uyochaza what is happening. Ungavele ustope i-medication because you are making the situation worse. Umthwalo we-MDR and XDR unjani compared to the usual TB in the region?
We Khusela project, Dr. Tebelele, we are focusing on the sensitive TB. And then we also have got Khusela upper background who's also doing the resistant TB. So when
wonderful.
we find those clients, we refer to Khusela. I mean to
Okay.
Khusela.
Good
Yes.
teamwork.
Yes,
Great
yes.
teamwork.
And
Well done. And I understand ukhusela kokudalanga ekhona eBhayi niqale nini, and also can you give us a window? I understand there's an upcoming launch of the whole project. When did you start in PE, and when are we likely to see the noise and the hype around Fear Plus?
we've started as with the clinic, Kwamama Mkhetho, facility manager Wapayana in July. And then we have just moved it to Fear Plus Clinic. Remember, we are moving, we are covering the catchment areas of the clinic. So once we are supporting Zwide, we screen all the people in that Zwide catchment area. And then we move to Fear Plus, and then we cover all the catchment area of Fear Plus. So currently, I've said we are at Fear Plus, Councillor's Office, and then we've got the upcoming launch on the 17th, on Thursday. We are launching the project officially.
On the 17th of November 2022, Khusela will be officially launching this End TB project in the Eastern Cape. And the role is to make sure that the burden of TB is downsized. The burden of abantu abasweleka TB will come to an end. But all we need to do is to make sure that we go for screening. Masiyohlola i-TB, izikhohlela, i-X-ray. Abantu badla ngokuthi igesi khange ndiyenziwe. Now ukhusela uza negesi kuwe. Awulindeki noba uthi ugule, but you are done an X-ray as a screening tool. Yinto okhangela uba akho TB ingabonakaliyo ngesikhohlela na enofumaneka. Xa ujonga i-X-rays, so far seniqalile usebenza from July up until now. Baninzi abantu abaphosakala kwisikhohlela then bazofumaneka nge-X-ray.
Njengoba senditshilo doc, baninzi abantu abaphosekeleyo kwisikhohlela abazofumaneka nge-X-ray. As a result, I felt like I wish we had lot of digital X-rays, Dr. Nyat. Some will be in sub-district A, and then some will be working in sub-district C, because I feel like we will be missing a lot of clients if we didn't have a digital X-ray as a screening tool.
That's a very good step forward, and I see Razia has actually joined us. And what other message would you like to pass to all our followers and viewers, and especially to the people around Fear Plus and Zwide?
To people in Fear Plus, you're more than welcome in our launch on the 17th of July. Oh, sorry, Koringa le date is calling. On the 17th of November in Councillor's Office there. And also, what I would like to say, let us support our people who have been diagnosed with TB so that they can complete their treatment, and then let us all make sure that we do take our under fives if there's a person who is diagnosed with TB for TB preventative, because that is another thing that we find out as Khusela, that there are a lot of children who are not being initiated on TB prevention. So let's protect those kids and those tiny lungs. And another thing that we have generally, that is a challenge when it comes to TB, like the mushrooming of clients. An informal settlement at Wesley. So now I just go to Soweto. I don't request a transfer letter from Wesley to Soweto. So we are then like pleading our clients that
Sister Thuletu, you're a little bit frozen, but for abantu who have just joined us, we're talking TB. There's Khusela project in Port Elizabeth in the area of Zwide and Fear Plus as a starting point. They are screening all people, healthy looking people. You don't have to be coughing. They are just screening everyone for TB. They are not only asking you questions, but when you are X-ray, uthatha isikhohlela, uxilongwe, then xa ithe yafunyanwa i-TB, uyathathwa usuke kwikliniki uqaliswe kwi-treatment, then uncediswe so that ungathi hayi ndiphelelwe yi-bus fare and so on, to make sure that people do complete their TB treatment. And then usister utashile kwinto yoba kuyenzeka in terms of side effects xa uqala i-TB treatment umchamo lo ujike ikhala, so ungothuki xa umchamo wakho uyikhala i-different. Into elindelekileyo leyo. Usenoba nayo irashanyana, usenoba nabo ubunaranyana ngosanda uqala i-treatment, but zonke ezo zinto azithi yiyeke i-treatment ye-TB. But okubalulekileyo, chazela aba bantu bebekunika i-TB treatment kule klinikhi kuyo okanye any Khusela team member into, but this is what I'm experiencing. And then after that, they will tell you exactly what to do. Sometimes ubunari obu kusenothi hayi treatment ke xa uzawulala okanye uyahlulahlule ngale ndlela uzawugayidwa ngayo yi-professional. Sometimes kuyenzeka i-treatment ye-TB ikwenze ube namehlo ayelo, le nto kuthiwa i-jaundice. Xa kusenzeka loo nto suba alarmed, sukothuka, ungayikhalali i-treatment, ndithatha i-treatment yakho uye kule klinikhi ubuthatha kuyo i-treatment, uchaze into yoba nantsi into eyenzeka kum, ndizibona amehlo ayelo, umchamo wam ujikile ubrown, oko ndithe ndaqala i-TB treatment. Then i-health professional iza kugayida to make sure into yoba there is a way. Ayikho ingxaki engenaso isisombululo. uKhusela is there to assist you. uKhusela team member is there to guide you. uKhusela member is there to make sure into yoba you do finish i-treatment yakho ye-TB from the beginning until the end. Can you please unmute Sister Thuletu? Welcome back. We still,
Thanks,
I'm still carrying on. At least
hello shedding Nelson Mandela.
ndivele ndimi andisosithuthi sendoda. Xa ndikuphunqule ndisheka ndiqhuba, ufika ndiqhuba apha ndibile ntiki kule ndawo uyeke kuyo.
No shedding, Doc. Sorry about that.
No problem. No problem. Any other message that you would like to pass to all our viewers and followers? And Dr. Razia, if there's any message that would like to pass to, you can actually come through.
No, Doc, kugxininisa nje bantwini ukuba sonke masambeni siyokutesta i-TB. Ezi services zimahala, masike siyeni ngoba anqabile lamathuba ukufumana i-services ezifana ne-digital x-ray zisiziswa ebantwini. Kangoba njengoba sise-councillor's office sizawumuva because we are trying to come closer to our elderly clients, even ne-clients ezingangathi ngoba zifuna ujima zenqena uwalker, so sifuna ukuza kuba abantu sibasondelele. So ayikho excuse yoba umntu angaskrini for i-TB. Enkosi, Doc.
Akukho sizathu soba singayitshekitshi i-TB. Akukho sizathu into yoba uthi ubila kube manzi amashithi, ubiliswa into ongayaziyo, uluze weight for a reason that you cannot explain. And there's this thing that everyone on a TB ngoku niyamtesta for HIV. Kunjalo?
Doc, we are actually integrating our services. Everybody who has got TB is being tested for HIV, but of course they are tested in the facilities. Remember, I said we are working with the Department of Health. We are also encouraging our youth, Doc, because when we're about to do a digital x-ray, there's a question there: are you pregnant, or do you suspect that you are pregnant? So we've also picked up that most of our youth are not using the contraceptives. So we're also encouraging them and referring them to the facilities that they must be on contraceptives. We also have got a pack of condoms because we've also picked up that some men does not want to be done digital x-ray, but they want a pack of condoms. And we also appreciate that.
Hey,
so we are also promoting HIV testing, your sexual reproductive health services.
And let me just emphasize one thing. Kunzima, even nalo mcimbi wodavaza, if kukho area yomphunga wakho engasebenziyo, uba kwi-area of your lung that is affected by TB, you will be aware of your breathing. Le nto sithi shortness of breath, le nto sithi dyspnea, uzaba nephikanyana, uzawuthi usazama nalo mjikelo wakho uwiki, ubone into yoba uthi waminxi liphika. So kubalulekile into yoba imiphunga yakho ikwazi ufunxa i-oxygen kakuhle, izokwazi into yoba nale nkonzo uzama uyenza ingapheli esithubeni uphelelwe yipetrol, ngoba i-TB yenza imiphunga ingaphefumli kakuhle nokuluza i-weight, loss of weight. Xa uluza i-weight ungayazi uba uyiluzelani, uyicakisile usister loo nto leyo, please go for TB screening. Zininzi indlela abazisebenzisayo to make sure that they pick a lot of TB. There's a way of checking TB in urine. Are you also offering that as Khusela?
No, Doc, that's also offered in the hospitals, the TB lamp. Yes.
So it's mainly sputum examination and x-ray with Khusela?
Yes, Doc.
and the support, the amount of support that we are giving patients, I think Nelson Mandela Bay region is going to benefit a lot. And thank you to you and your partners for all the tremendous work that you are doing to end TB. And it's even good that there is a team work and synergy with Khusela to make sure that those that are having TB that is not sensitive to the usual drugs, they are channeled properly to make sure that no one is left stranded.
And what is also nice, Doc, is the proper follow-up. And what we've also picked up, Doc, sorry about that, we are also getting art defaulters. One does not have TB, but has defaulted art. So we also ask those questions. Are you HIV positive? And then a person will say, yes, hey, but I've defaulted treatment and now I'm scared to go back to the clinic. In as much as we are a TB project, but we are also supporting those clients and linking them back to care, because we said TB, HIV positive people are at high risk of getting TB. So we are also getting those treatment interrupters. I don't want to use the word defaulter. So the facilities are very appreciating that we are linking those clients back to care, and that is reducing the number of lost to follow up within the district.
Are you doing any workshops for nurses for this stigma and discrimination thing? Because abanye abantu abadefaultayo bathi hayi kule clinic andihoyo imini yonke abantu be-TB bahlala bodwa and so on. This thing of queuing system, is there a way Khusela is addressing that? Kuthi abantu be-TB mabahlale ngapho okanye iifayili zabo zine-tags ezithile. Is there anything like that, or is there a way that you are doing to manage such issues ezenza abantu bangathi find it easy to go to TB clinics or to fetch their treatment okanye bafuna uthumela abanye abantu because they don't want to be seen to be having TB?
We are working very closely with the Department of Health and the TB focal nurses. So as a nurse, it doesn't really matter whether you are a Khusela or you are a Khusela, you are a client advocate. So if you are going to any of the facilities and then you find out that there is a challenge, or maybe there is something that might or is kind of discriminating the TB clients, you address that like professionally with your own colleague.
And then lastly, can you just demonstrate the cough etiquette for us? How should we cough? Maybe I'm in a bank or I'm in a clinic. How should we cough?
Okay, you can use the elbow, Doc. And then you can cover your whole nose and the mouth. Or if you've got a tissue, you can just cover the whole and then discard it in the bin, and then you can wash your hands.
Nivile bantu bakuthi. No. Ugqibe uyophaka ngeso sandla. Nivile, there is what is called cough etiquette. Usister Thuletu, there is a way of coughing. You don't cough as if you cough ekhohlela umuntu ongazinto. You don't cough as if awukhohleli umuntu ulandela Aphile Communications. You don't cough as if we never met a Khusela team member. Now that we've been here, everyone who's coughing, even if it's a small cough according to you, even if you are sneezing, there's a proper way of doing that to make sure that you don't infect the person next to you. Cough etiquette. You want into an etiquette. No get a bedroom in etiquette. Ne table manners etiquette. Ne TB lero khohlela in etiquette. Khohlela inene kazi. Bonakala ba lo muntu utrainiwe uyayazi infection control. Fortunately, COVID has actually helped us to advance some of these lessons. Thank you so much, Sister Thuletu, for these extra lessons. Any other lesson that would like as a bonus point, as a closing point to all the people that are watching, as I check if there's any other question that I'm leaving out, or any of the team members, Khusela, if there's anything that you want to add, you can jump in and add before we close. Sister Thuletu, anything else?
Kwela ngicala gqirha ndiqhibile ndifuna ukuthi balandeli bakho mabadavaze bezazi basebeyenzile i-digital x-ray kwaKhusela.
Le truck ine symbols ezinjengesiskipa sakho ne le truck ihamba isenza i-x-rays.
Le truck ihamba isenza i-x-ray ibhaliwe LTE but iza kubhalwa ke uKhusela.
Okay.
Yes.
It's a truck,
but
not a very big truck.
Sinayo igazebo Dr. Thebelele, sinayo igazebo ebhaliweyo Acuity because sisebenzela phandle ngoba sifuna abanye abantu basibone ibhaliwe igazebo yethu Acuity Innovations. And siyalawuthela ke nokulawuthela ukwenzela into yoba abantu beve uba ikhona inkonzo efumanekayo eFear Plus.
Yokuzama ukulwa nokuthintela unaniselwano ngentsholongwane ye-TB. I don't think it doesn't mean ke ngoku ngabantu base-Fear Plus abane-TB, but bathi sister bajonge iikliniki ezidreyinela ezizwide clinic, so bahamba ngelaa chain and niyangena ezithaveni screen abantu for i-TB. Mhlawumbi nifika abantu beshushu phana nithi kotlela bhuti okanye kotlela sisi.
Dr. Thebelele, kaloku Nelson Mandela can never run away with the fact that one, safety, of course, and then privacy, and then we go in the household. But we also ask if there's anyone who's at work or there's anyone who's not around, so that the next day you'll know that you missed somebody. Remember, we don't want to leave any stone unturned, as politicians normally say.
Sister, is there any intention to go to schools?
Yes, Doc, we do have intentions to go to schools, but there are processes and procedures to follow because those are people who are under 18, which needs consent from the parents. But what is nice is that when the schools are closed and the parents are there at home and then they give consent, so we do get those children. And sometimes we close a bit late to accommodate those who want to come and do the digital X-ray after school. Otherwise, going and parking on the school, there are channels to follow.
Wonderful. If you happen to have stopped TB treatment for whatever reason, uthi Sister Thuletu, nobody will insult you, nobody will judge you. You will just be taken back into the system, uphinde uqalise treatment yakho, because TB is not about you only. It's also about the person next to you. It could be your child, it could be your relative, it could be your uncle, it could be your dad, it could be your grandmother. And ke ngoku abadala immune system yabo is quite weak neyabantwana, so they may not exhibit symptoms of TB very, very easily. So don't be selfish. Go for screening se-TB to protect the country and to reduce i-TB burden. Khusela ulapha is bringing the service at your doorstep through i-X-ray, through isikhohlela, through i-examination. Akho nto ikhosta, ayithatha nje ixesha lakho uzinikele uxilongwe for i-TB. Ndicinga uba sigqibile Sister Thuletu, mandibulele bonke abantu ababukeleyo nabantu abathatha lessons. And we're not only taking lessons for ourselves, but we're taking lessons for everyone obemamele nobengamamelanga, to make sure into yoba when there's someone coughing, une responsibility to remind them there's something called cough etiquette. There is a Khusela project in the Fear Plus Zwide area that is doing free TB screening, where you can also do X-ray. Igesi ngokasewundithandazelwayo into eyenziwayo free of charge. Noba ubusiyothenga umbane okanye ubusiyokha amanzi, then ubone benantsi le truck uthi andicela uskrinwa for i-TB. A lot of people are picked bengenawo ne-symptom A1 ngobona nje le X-ray ukuthi kanti umntu ujikeleza ene-TB. Thank you very much. We're going to hold it there for today. And then don't forget, on the 17th of November, Khusela will be launching the big project Lesithetha Ngayo of TB screening and TB in the Eastern Cape. The ambition and the goal and the vision and the strategy is to end ukuphelisa TB in the Eastern Cape. And the Nelson Mandela Bay region is one of the very much burdened inomthwalo noxanduva nabantu abaninzi abaphila nentsholongwane ye-TB. Yiyo le nto bazozinza apha, then sinethemba le nto yoba iteam yabo izawunaba ifikelele nakwezinye indawo ukuzama ucima umlilo, but akusoze ucima umlilo if you don't respond to the call. Fear Plus sawunibona apho ngolwesine, ndabe ndilapho nam ndibhinqe omfutshane ne-cough etiquette yam neteam yakwaKhusela. See you on the 17th of November. Siqala ngabani ixesha Sister Thuletu?
Izawuqala ngo-10 Doc, iphele ngo-1.
10 a.m. Mna zabe sendiphana kwango-9:30. I-breakfast ndayityela phaa, ndinethemba
Sizawuqala sikwenze i-digital X-ray Dr. Thebelele.
Thank you so much. I'll do it live. Ngene egesini babona abantu bale gesi yenziwa. Senonze abantu nayo TB nam. Possibly that I
Dr.
could be having
Tebelele,
TB.
no Dr. Maji, no Dr. Nyati will do digital X-ray live.
Thank you so much,
Dr.
Sister
Maji,
Thuletu.
thank you, Doc.
Thank you. Dr. Nyati, CEO ka Khusela, is also in the background and watching us. Dr. Razia, heading the project, is also amongst the viewers. We're looking forward to meeting you on the 17th of November, where we'll be launching the project officially. But the project is already running. Island will launch. It's just an official launch on the 17th. Otherwise, we can go as early as now. TB Aphile Plus Clinic. Jonga la track yawa Khusela, then ujonga abantu abanxibe t-shirts, then we shall end TB as a team. Thank you so much, Akwiti, and thank you so much, Khusela, and all the best, Sister Thuletu and the team. And thank you very much for the insight on TB. Now we know TB is not an embarrassing disease. It's something that can affect people as beautiful as you are, and people who look as fit as anyone. But screening helps to pick it so that it doesn't spread to other people. Thank you so much to all the people who have given us feedback and all your questions. May we learn and teach others everything that we've learned about TB. Thank you so much.
Enkosi gqirha nabalandeli bakho.
Enkosi, Sister Thuletu.